have three types of infections. We have an acute infection where animals usually present clinical signs and are dying. In those cases, in acute infection, usually clinical signs and pathological observations of dead animals will lead you to the hypothesis that it may be APP. In those cases, we recommend to send samples to the laboratory just to confirm that it is APP and perform serotyping. I will come back later on the serotyping part, which is quite important. You have also chronic infections. So those infections, sometimes animals present some clinical signs, sometimes they do not. And you will get some lesions at the slaughterhouses. Diagnosis of those cases are a little bit more complicated because from the lesions at the slaughterhouses, usually we cannot detect the pathogen. So you need to perform serology. And when you have serology positive for APP, especially for pathogenic serotype, we will talk about this later, you can correlate the presence of lesions at the slaughter and the presence of positive serological reactions. And then you have the subclinical type of infection, which is the most complicated. Why? Because animals do not present clinical signs and there are no lesions at the slaughter. So animals look healthy, but they might be carriers of pathogenic strains, and under stress, presence or other infection or problems in management, they can develop disease all of a sudden. And diagnosis of those kind of infections are done by serology again, and we will talk later probably about different type of serological tests that can be used. The serotype is quite important because there are virulent strains of APP and there are very low virulent strains of APP. And most herds are infected with low virulence APP. How to differentiate them? Usually, serotyping will give you the tool to differentiate virulent serotype from non-virulent serotype. In other words, some serotypes are highly virulent, other serotypes are low virulent. And this is extremely important to know if you are dealing with a virulent serotype or not. Usually in a country, there will be one or two serotypes which are most prevalent and causing disease. The identification of the serotype in the past was done using antisera. These techniques are quite complicated and not very accurate. Presently, there are PCR techniques that can differentiate very precisely the serotype involved. It's usually more difficult to have a diagnosis of a herd free of something than having a diagnosis affected with something. Because when you say the herd is free, you have to be sure that it is free. Again, if the herd does not present animals with clinical signs, usually serology should be used. Serology is a herd diagnosis, so it's not an individual diagnosis. You need to take at least 30 samples and more than once in the year to carry out a surveillance of the distribution of the disease. So using good serological method and having negative results in serology can tell you that the herd is really negative for APP.